So this is one of our cases for today. I think this one's really exciting because there's a lot of moving parts in this operation. This is a lady that's lost a lot of weight, and our plan for this patient is to do a variety of surgeries. We're going to do a bra line back lift, a tummy tuck, a brachioplasty, and then add some implants with the repeat lift. So in the past, she had a previous breast reduction, which does present some challenges because of all of the scars, and we have to work around some of those scars. If we look really quickly on the upper picture on the right, you can see that she has a lot of excess back skin. So in order to improve the waistline, I find that oftentimes doing a bra line back lift really helps to tighten and snatch up that upper waistline. So what you can see is on the table markings from the front of her, we've already done the bra line back lift, and you can see on the sides, there's some extra skin on the sides. And this is the after result right on the table. So what we did essentially is added in some high profile implants, removed the excess skin in the armpits, and then brought that incision down to connect with the bra line back lift to really help shapen and sharpen and kind of carve out that upper armpit lateral chest wall area. She's doing great post-op, and hopefully she'll be excited for her results.